Rosacea is a condition affecting the skin of the face. Typically affects the centre of the face, the nose, the cheeks, the forehead and the chin, although occasionally it can go down onto the neck and shoulders. It
was probably about 3 years ago. I started to get just like really red skin, like in the forehead and nose and chin area.
It affects women more than men, and typically it appears between the ages of 30 or 40. However, some people start to get the early signs in their 20s.
It would flush and then it would go away again, and it just gradually got worse. And then I started to get like small, almost like little hard lumps in my face.
The very earliest symptoms of rosacea tend to be a flushing, a tendency apparently to blush more frequently, but then later on you'll get more severe symptoms, including a permanent flushing.
I started getting eye infections quite frequently. My GP recognised that it was rosacea and he referred me to a dermatologist.
At the severe end of the spectrum of rosacea, there are a couple of problems that can be quite unpleasant for patients. One of which is a thickening and swelling of the nose, which is called rhinophyma, and the other one is dry, sore eyes and lid problems. In both of those cases, often a referral to a specialist is needed. At the moment, the cause of rosacea is a bit of a mystery. There are lots of theories, but not one that is definitely the case.
I didn't notice that it was when I was eating certain foods and things. It was just constantly there. Then it would go away for a little while and then it would come back again.
There are a number of things that can trigger rosacea, and it depends from person to person, so it's important to try and learn which are your triggers. Very common ones include sun exposure, so for example using a sunblock may make a difference. Also using alcohol or eating spicy foods may make a difference. Being exposed to a lot of stress often causes a flare-up of rosacea, as do temperature changes, going out in very cold weather or hot weather.
I always use a factor 50 on my face, like cover my whole face in it, just because I did notice when I was in the sun after I got diagnosed it was worse.
Unfortunately, it's not a condition we can cure, but you can make quite a difference to the symptoms people are suffering. For the early symptoms, particularly flushing, it's mostly looking at avoiding the triggers that make it happen. As you move on to things like spots, we can use creams that go on the face, or you may be given antibiotics to be taken by mouth. When you get to the more severe symptoms, then you may need to be referred to a specialist for treatment, including surgery for thickened skin.
My GP put me on antibiotics for it. Took them for 3 months and it did go away again.
Some people try and treat their own rosacea using medication available over the counter. This is probably not wise to do it because often some of these medications can actually worsen the condition, particularly things containing scents, oils and alcohol-based treatments.
I probably did the wrong thing at first because my skin felt really tight with it. It was just really tight and itchy, and I thought I could use all these great products just to try and sort my skin out, but probably using too many products was doing the wrong thing.
Sometimes people may be recommended to use cosmetics to actually camouflage the appearance so that they feel less self-conscious.
Once I tried like different makeups and things and trying to cover it up, I thought that was probably my best option. But it makes you feel more positive when you can cover it up and people don't even notice.
Often people with rosacea find that they get quite low or even depressed because of the disease. And if you have that, don't suffer in silence. Go along to your GP. They can arrange for you to have psychological support and treatment.